Good afternoon. My name is Mariesa, and my presentation for today is about thoracic aortic aneurysm.
Yes, it's okay.
So, what is thoracic aortic aneurysm? Thoracic aortic aneurysm, it is the ballooning of the upper aspect of the aorta above the diaphragm. And this is my sample of aneurysm. An aortic aneurysm that represents primarily in the thorax region, which is the upper part of our body. And it is the body's main artery. The aorta carries the oxygen-rich blood from the heart to the rest of our body. When the aneurysm overstretches, it becomes weakened and it can burst. When it bursts, it can lead to death. Thoracic aortic aneurysm is much less common than abdominal aneurysm. Abdominal, you can find it here in the abdomen area. Oftentimes, it's caused by an abnormal breakdown of the elastic fiber of the aortic wall. A pseudoaneurysm, it is a bulge occur in the wall of the aorta. The bulge doesn't affect the three tissue of the aortic wall. And sometimes this aneurysm can cause by accident. What are the causes? The causes are, number one, hardening of the arteries, or what we call atherosclerosis. It is a plaque buildup in your artery. And it became less flexible, and then when it weakens, the pressure, it can cause weakening of the aortic wall and bulging of the aortic wall. What are the risk factors? It's high blood pressure and high blood pressure and high cholesterol. It is most commonly with elderly people. Second, genetic condition. What are the genetic conditions? Aortic aneurysm in younger people who were born with Marfan syndrome. What is Marfan syndrome? It is a genetic condition that affects the connective tissue all over our body, and they may have weakness in the aortic wall, and they are prone to aneurysm too. And what is the other medical condition? Besides Marfan syndrome, Ehlers-Danlos syndrome, and Turner syndrome, and other related conditions, it can cause aortic aneurysm. Ehlers-Danlos syndromes are the skin, joints, and connective tissue. It became fragile, and then it make our skin stretch. And what are the other medical conditions? It can be the inflammation of giant cell arteritis. What is giant cell arteritis? It is the inflammation of the blood vessel in and out of our scalp. And also Takayasu arteritis. It is the inflammation of the large vessel, which is common with a childbearing woman. Next one is problem with your heart aortic valve. It is a problem with your heart aortic valve. It is most commonly people who were born with a bicuspid aortic valve. It means instead of the aortic valve, instead of instead of three cups, which is this is the aortic valve, they have one. So, well, there's three cups. Instead of three cups, there are only two. So that's what we call bicuspid aortic valve. And then untreated infection. As we all know, any untreated infection can cause or develop aortic aneurysm. And lastly, traumatic injury. People rarely, with some people who were into accident like fall or motor vehicle accident, can develop aortic aneurysm. Is thoracic aneurysm hereditary? about 20% of people with thoracic aortic aneurysm and dissection have a genetic predisposition to it, meaning it runs in the family. And also, as I've said earlier, Marfan syndrome and Ehlers-Danlos syndrome and other related conditions, the wall of the major artery became weakened, and that's the aorta. Symptoms. What are the symptoms? Tenderness or pain in the chest, back pain, hoarseness, cough, and shortness of breath. These are just self-explanatory. Risk factors. The risk factors are age, tobacco user, high blood pressure, build-up in artery, or we call it atherosclerosis, family history, Marfan syndrome and other related disorder, and of course the bicuspid aortic valve. Diagnostic test. Diagnosing a thoracic aneurysm can be difficult because there's no symptoms, and of course oftentimes condition can be undiagnosed. Why? Undiagnosed means sometimes there's already a rupture and you don't even have the sign and symptoms. And also, thoracic aneurysm, when it is suspected, then your physician may order the rest of the diagnostic test. It can be chest x-ray or computed tomography, or what we call CT scan, or magnetic resonance imaging, which is known as MRI, and also echocardiography, which is the ultrasound of the heart. Abdominal ultrasound to look for associated abdominal aneurysm, and also angiography, which is the x-ray of the blood vessel. What are the treatment for aortic aneurysm? Treatments are regular monitoring. So if you have signs and symptoms, then consult your physician right away. And then next one is conventional surgery. This is a sample of conventional surgery where they deploy the graft inside your aortic valve to protect the aneurysm. So, there's a good blood flow in your heart, and there's less chance of rupturing. And of course, endovascular treatment. Endovascular treatment is a minimal invasive procedure inside the blood vessel. I have an article. Lenny, can you read my article, please?
Oh, what? Hindi ko mabasa.
Ay, sorry.
It's too small. 33-year-old asymptomatic Brazilian male with no significant prior medical history. Transthoracic echocardiogram revealed severely dilated proximal ascending aorta with effacement of aortic valve and aortic root. An immediate transesophageal echocardiogram was performed that revealed to proximal giant ascending aortic aneurysm of 13.0 centimeter. Significant family history of Marfan syndrome. Patient underwent successfully Bental procedure constituting construction of ascending aorta, aortic valve replacement, and implantation of coronaries.
Thank you, Lenny. So in my case presentation, it is a rare finding of patient with aortic aneurysm. Why? Because mostly it presents with complication like dissection or rupture. So how can it became big? without rupture or without dissection. It is also defined aneurysm exceeding 10 centimeter in its maximum diameter at current guidelines. Then they should go for surgical intervention, because when the diameter of the aneurysm exceed 5.5, then means they have to do something about it, because there's a big chance of rupturing or dissection. And then due to the annual rate of rupture, if it's beyond 6 centimeter diameter, then yeah, they should either do that surgical or endovascular or any treatment, because there's a big risk of rupture. And the ratio for thoracic aortic aneurysm is 14% from last year. So what are the prevention? Prevention are quit smoking and drink in moderation, avoid recreational drug, eat a healthy diet rich in whole grain, fruits, vegetable, lean meat and low fat dairy, and of course reduce your intake of saturated fat, trans fat, salt and sugar, and get a 30 minutes exercise on most day, and get screened regularly, especially for high blood pressure, because that's one of the root cause, and also to manage your condition. So I therefore conclude, early diagnosis of a thoracic aneurysm is critical to managing the condition. The larger the thoracic aortic aneurysm, or the faster it grows, the more likely it is to rupture. The risk of rupture increases when the aneurysm is larger than about twice the normal diameter of a healthy aorta blood vessel. So that was my topic for today. I chose this topic because my son had thoracic aortic aneurysm. Why? Due to when he was 7 years old, he had a Kawasaki disease. It's a very rare, disease for 10 years old and below. And it targets the immune system, and there's an inflammation of blood vessel, and it can cause heart attack at young age. So after this, I'm gonna give this to my son, so he would learn about thoracic aortic.